Ryan Reynolds here from Mint Mobile. With the price of just about everything going up during inflation, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, how to get 30, how to get 20, 20, 20, how to get 20, 20, how to get 15, 15, 15, 15, just $15 a month? Sold!
Give it a try at mintmobile.com/switch.
$45 up front for 3 months plus taxes and fees. Promo rate for new customers for limited time. Unlimited more than 40 gigabytes per month. Slows full terms at mintmobile.com.
Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in nursing school and at the bedside. So this is another in my special summer series of Ask Me Anything, and I'm really excited to answer these questions for you today. But before we hop into that, let's take a quick minute for our listener shout out. And this one goes out to Rebecca, who says, I just wanted to say that these podcasts are incredible. I'm very much a non-traditional nursing student. I'm 52 years old and I'm halfway through a direct entry Master's of Nursing program after a 30-year career in public policy and educational administration. I learn best through listening, and these podcasts are an amazing study tool for my morning dog walks and runs. Thank you so much. And also, it's never too late to go back and change your profession. Rebecca, I 1000% agree, and I love that you are using the podcast to help you thrive in nursing school and that you had the courage and the motivation to completely change careers and pursue your dream. I'm so proud of you. Alrighty, ready to dive into this Ask Me Anything? We're going to talk about making the transition from unlicensed personnel to nursing. We'll talk about being really shy and how you can still thrive in clinical and in nursing. We'll talk about realistic study plans and how to make them, and a question that I received recently about heparin and warfarin. Okay, so let's start off looking at this question from Anne, who I believe works in Canada, because the job title she used was personal support worker, which I think is a Canadian thing, kind of like a CNA. I am assuming it's kind of the same. So just to be more generalized, we'll say unlicensed assistive personnel, or UAPs. That's kind of a general term. So Anne is reaching out saying, I need some guidance as I navigate a transition from being an unlicensed assistive personnel to a nursing student. As an unlicensed worker, I find comfort and fulfillment in the bustling hospital environment, eagerly responding to call bells and assisting wherever needed. I enjoy being part of that team. However, this comfort has led me to inadvertently overlooking crucial learning opportunities in my new role as a student nurse in clinical. I'm having a difficult time with this transition. All right, so Anne, this is definitely something that a lot of students struggle with. Many nursing students start out as a personal support worker or a CNA or a unit secretary or even as a volunteer, and they're very comfortable in those roles. But as the student nurse, it's really vital, and you know that this is important because it's on your mind. It's really vital that you have the mindset that you are the nurse. Even though you're not licensed yet, you have to be thinking, I'm the nurse. What would the nurse do? What do I do as the nurse? So that your focus is on the nurse's role. And what I tend to see with students is a lot of times they'll fall back into that unlicensed assistive personnel or UAP role because it's very comfortable. Even you said that you find comfort and fulfillment in that. So when you're faced with a new challenge, when you're in an uncomfortable environment, it's almost just natural instinct to fall back into what is comfortable, into that role where you know what you're doing, you know your skills, you know your role, you know all of it, right? But it's very important to understand that nursing school is not supposed to be comfortable. It is basically one of the most uncomfortable times of your life. So you have to be always pushing yourself to the max of your ability. So it's really important that you have a very clear understanding of your role as that student nurse and how that differs from your role as an unassisted or an unlicensed assistive personnel or a UAP, which would be a CNA or in Anne's case, a personal support worker or PSW. So as the student nurse, your priorities are going to be things like assessing your patients, watching for changes in condition, coordinating the plan of care, helping patients meet their goals, and of course, keeping your patients safe. And as the student nurse, you're also going to be involved in higher level hands-on skills and constant critical problem solving. So as you are in clinical, when things come up, I want you to ask yourself, is that a nursing priority or is there something else that I should be doing and maybe should I delegate this instead? And if it is something that should be delegated because you do have a more pressing nursing priority, then you can delegate that task. And if you would like some assistance in understanding delegation, you can listen to episode 120. Note that the delegation parameters that I share in that episode may be specific to the US, but it gives you an idea of when and how to delegate effectively. Now, there are a lot of things that nurses do that could be delegated, but aren't. For example, taking a patient for a walk in the hallway or getting a patient up to the bathroom. That 100% could be delegated in a lot of cases, but aren't. And this doesn't mean, though, that the nurse is ignoring their priorities while they're taking care of these ADLs or activities of daily living. So let's say you've got a patient you're getting them up to the bathroom. While you're doing that, you are assessing the patient. You're assessing their tolerance for mobility. You're assessing their gait. You're thinking about how this fits in with their whole care plan, with their whole treatment plan, because in a lot of cases, mobilizing and going to the bathroom are key patient goals. You're thinking of ways to help the patient meet their goals. So you're doing all this nursing thought processes in the background as you are helping your patient with things that, yes, could be delegated, but maybe you didn't in this instance. So just to kind of recap, when you're thinking about your student nurse priorities, number one, assessing your patients and recognizing changes in condition, and then, of course, responding appropriately to those changes in condition. Number two, and these aren't necessarily in any order, there's 5 of them here. Number two, creating goals with and for the patient. This is basically your care plan, coming up with goals and figuring out how you're going to get them there. Number 3, working on your hands-on skills, such as dressing changes and Foley catheters, and also understanding the tech involved with nursing. If you're in a critical care area for clinical, understanding the monitors and what all the numbers mean. Then number 4, giving medications safely. And this also includes knowing what to assess for your patient. I always say assessment is the most important nursing skill that you have. And then number 5, you're also assisting patients with ADLs as needed. You don't delegate every single one of these. That would put way too much workload on the CNAs or the PSWs. You'll do some of it, they'll do some of it. We all kind of share in this together. And it's really important that you solidify these skills because guess what? You won't always have assistive personnel available. So the other thing that I would say when you're in clinical, Anne, or anyone else who has this question, is I want you to constantly be looking for learning opportunities. So when you get to clinical, share your goals. What are you looking to solidify? What are you looking to match up with what you learned in class or in lab? Talk with your preceptor that you're working with that day about those things so that they can keep an eye out for learning opportunities for you as well. And then as learning opportunities come up, even if it's the same one every time you go to clinical, do it over and over and over again. Because I promise you, things do not always go according to plan. Let's say you're setting up a feeding pump for a patient with a feeding tube or a PEG tube. and you've done it 5 times already, and the nurse says, hey, I've got a feeding pump to set up. Would you like to do that? You're going to say yes, even though you've done it 5 times and you feel pretty confident. I promise there's going to be a time when you do this and something goes haywire. And it's really important that you learn from those experiences, because I'm telling you, the learning happens when you muck things up, right? So do things over and over. And then when you're doing ADLs with your patient, I want you to put your nurse hat on. What can you assess while you're helping your patient with their ADLs? How does what you're learning about the patient, what the patient is able to do or not able to do, how does that impact their plan of care? How are medications maybe affecting their ability to perform their ADLs or safely perform their ADLs? For example, let's say you have a patient taking a diuretic like furosemide. Well, how's that going to affect their ADLs? For starters, they're going to be getting up to urinate way more often, and they could have dizziness when they stand up. So big safety concerns with that patient. What if you're taking a patient with pneumonia for a walk or to the bathroom? Let's say you're taking them to the bathroom. How do you anticipate their needs? As the nurse, you're thinking, oh, okay, so Bob's got pneumonia. He might get short of breath. So he's on oxygen in bed. Let's make sure we have the extra long tubing so that we can get all the way to the bathroom so I don't have to take him off oxygen. Or if he gets too winded, how about I just get a bedside commode so that he doesn't have to walk so far? And then when you do get Bob up, you're assessing his work of breathing. You're assessing shortness of breath. You're going to check his oxygen saturation level and his heart rate and his respiratory rate to see if there were significant changes with that would tell you he's not tolerating this level of activity. So these are the types of things that a nurse is thinking about when they are doing ADLs with their patient. So Anne and anyone else with this question, I hope that helps you kind of put your nurse hat on when you are working in clinical so that you can get the most out of that very precious clinical time. All right, the next question is from Erica, who says, I'm super shy. I get so nervous in clinicals. How can I succeed even with this shyness? So Erica and anybody else with this issue, this is so common. Please don't think that you're the only student nurse to be a little bit concerned about your level of shyness, because we are working in a very dynamic environment where you have to interact with actual human beings, and that can be scary for someone who's shy and not used to that. So I just don't want you to feel like it's just you. This happens all the time. The only way to get past this is to keep showing up, to keep doing the thing that makes you uncomfortable. Over time, it will get easier. You're going to feel awkward. You're going to feel weird. You're going to feel like an actor sometimes, and that's okay. But I want you to keep walking into patients' rooms with confidence. If you don't feel confidence, fake confidence, okay? Keep introducing yourself and saying hello, looking people in the eye when you do that. Keep asking your patients questions. Even if you don't have any more assessment questions to ask them, you're definitely asking them things as you're doing your head to toe, for example. You can just ask them questions about their life and get to know them a little bit. You want to keep speaking up for your patients and sharing your concerns with the nurses you're working with or with your clinical instructor, and keep engaging with all members of the staff. You've just got to keep doing it. I promise it gets easier. I had the same exact problem when I was in college. And what I did was I got a job as a waitress. And boy, let me tell you, you have to walk up to a table full of strangers and say hello and talk to them about the menu and take their orders and interact and engage. And that was really hard for me initially. But you know what? I got used to it. And the more I did it, the more I enjoyed it. Now it's really easy for me to do that, even though I am still a very shy person. I know that I can walk up to a group of people and say hello. I can walk into a patient's room and confidently introduce myself and greet them and talk about their plan of care. And you can too. So a safe way to do this is maybe to practice outside of clinical. So for example, Let's say you are out and about somewhere and you find yourself kind of shying away from an interaction because you're like, oh, I should say something, but I don't really want to because I'm so shy. Does that ever happen to you? It happens to me all the time. So I want you to notice when this is happening and do the thing anyway. So it might be something really small. Like, let's say you're at Starbucks and you get your drink from the barista and you really want one of those drink stoppers in there, but they're behind the counter. So shy you might think, oh, never mind. Maybe I won't spill it in the car. It's fine. Or how about the you that is practicing being more confident in your actions with people or your interactions with people goes ahead and asks the barista for that drink stopper. This is a low risk way to practice. Maybe going up to someone at the grocery store, someone that works there, and asking where the candied almonds are or whatever. Getting used to approaching people, interacting with them, asking questions, and talking with them. Doing this in a low stakes, low risk environment that's very safe is a great way to practice. You can also practice in class. Make a point of asking questions in class or answering a question in every single class or lab or sim or whatever. Yes, it will be difficult at first, but it does get easier. So I took a couple of classes when I came back to become a nurse, when I went back to college, and one of them was sociology. No, it wasn't. It was anthropology. And one of them was statistics. And both of those instructors graded you on class participation. And I was not a big class participation person at that time. And I was just really determined to get good grades. So I was like, you know what, Mo, you're going to have to suck it up. You're going to have to speak up in class. And I didn't want to do it, but I forced myself to do it. And by the end of the semester, not even that long, halfway through the semester, it was no big deal for me to raise my hand and ask a question or offer a comment or an observation about whatever we were discussing. So that is just an idea for ways that you can practice this in, again, that low stakes, low risk, safe environment so that when you walk into clinical, you might not feel as scared. Yes, you'll still feel nervous because clinical, after all, is a little nerve-wracking for students, but you'll have some practice. And then you're just going to keep getting in there, keep walking in, keep saying hello, keep asking questions, keep talking to people, keep looking them in the eye. You absolutely can do this. All right, let's take a quick minute for a break. And when we come back, we'll talk about making a study plan and a common question I get asked about heparin and warfarin. I love hosting parties. In fact, my friends have called me the hostess with the mostest on more than one occasion. And a key ingredient to hosting a great party is having great wine to share. And with First Leaf, I always have fabulous options to choose from. And that's because First Leaf isn't your standard wine club. It's so much better. Instead of getting selections from just one winery, each shipment is a personalized selection of wines from around the world. And because of First Leaf, I've discovered that I love the white wines from South Africa, Washington, and Australia. Wines I probably wouldn't have discovered on my own. Not only have the prices been amazing, but the wines have been so good. I love a crisp, refreshing white wine, and First Leaf knows that. So that's what they select for me, and every bottle has been a winner. I can also tailor my membership. Choose 6 or 12 bottles, determine how many reds or whites I want, and even select a shipping window that works for me. So get wines to sip and share at your next summer party with First Leaf. Go to tryfirstleaf.com/nursemo to sign up, and you'll get your first 6 hand-picked bottles for just $44.95. That's tryfirstleaf.com/nursemo. Try firstleaf.com/nursemo. So this next question, I don't have a name for this one. I think it came in anonymously, and it was asking about how do you make a realistic study plan for exams? So this is going to vary a lot depending on how you learn best and the type of class that you're in. But let's just say we're looking at like a med-surg class, okay? So this is what I teach students to do in my boot camp. I go through a whole process with that, a whole 5-step way to turn your class notes into something that is usable and that commits things to long-term memory, I'm going to give you just like a quick overview here of general advice for developing a study plan. So the very first thing I want you to do after you go to lecture, so you go to lecture and you've got let's say the teacher gives you the PowerPoint slides and you've got those, you've downloaded those and printed them out maybe, or you've downloaded them to your iPad. So you're using something like GoodNotes or Notability to take notes. So however you're doing this, a lot of times what we have is a PowerPoint slide and we're going to jot some things down. Well, what do those notes look like when you go back to them later? They're kind of a mess, right? So I don't like studying off PowerPoint slides because honestly, they're just a headline or a header with some bullet points with no context of how things relate one to the other. There's none of the anecdote or the storytelling or the for examples or any of that, right? It's just, here's a couple words at the top and here's some bullet points. So if you're expecting to go back and study and learn off of that, your brain is going to have a harder time working with that and making those connections, and your brain's going to get fatigued and you're going to feel frustrated. So the very first thing that I want you to do after class is rewrite your notes. And I get a lot of flack for this. I get a lot of people saying, I don't have time to rewrite my notes. I have to study. Well, guess what? Rewriting your notes is studying. It's actually an incredibly engaged and dynamic and effective way to study and get that information more into your long-term memory. Get that information from what you learned in class to truly understanding the concepts. So the key with this is to do this pretty soon after class. I would not let more than 2 days go by. When I was in school, I did it the same day or the very next day. And yes, it takes time. But again, it's highly, highly effective study time. So go to class. After class, rewrite your notes. And yes, this will take probably 2 to 3 hours. But again, it's not wasted time. It is highly valuable study time. And then you're going to review your notes regularly in the time leading up to the exam. So don't just rewrite your notes and then forget about it. And then 2 days before the exam, think, oh my gosh, I got to pull up my notes on respiratory conditions. No, you're going to pull them out. You're going to review them. You're going to look back through them. This is an evidence-based way to study with that repeated exposure. So schedule time in your planner to go back and review your notes. And then as you get closer to the exam, maybe 3 to 4 days out, probably a shorter window if you're in an accelerated program where you might have an exam almost weekly, then you're going to start studying using active recall. You can use flashcards for this. You can do NCLEX practice questions. You can meet with your small study group of possibly 2 other students and quiz each other or teach each other concepts. If you're using the Cornell method, you can utilize that to cover up the right side of your sheet and just try to talk through the concepts as you go down them on that left side column. And if you're not sure what the Cornell method is, I do have an example on my website at straightanursingstudent.com/taking-notes, or you can just go to the website and type Cornell, Cornell, into the search bar and it will come up. And it's basically a really great way to jot down your notes so that there's almost like a question on the left side column and then the answers or the concept explained on the right side column. So if you've never used the Cornell method, that's one great method to utilize. And that is basically how I would study and make that study plan for exams. Scheduling time to rewrite your notes, scheduling time to review your notes, and then scheduling time for active recall, which includes NCLEX practice questions, flashcards, things like that, where you're having to actually recall the information. And then if you want a more detailed explanation with a few more tips and tricks, then you will find that inside Crucial Concepts Bootcamp. So if you're already a boot camper, you want to check out the Learn Like a Nurse module. And if you are not a boot camper, then you can check it out. I'll put a link in the episode notes, or you can go to straightanursingstudent.com/bootcamp. All right, our last question is very common from students, and this is, why would a patient be on both heparin and warfarin at the same time? So the reason for this, well, let's first back up a little bit. Heparin and warfarin are both anticoagulant medications, very common to use in patients who are at risk for a clot, such as a patient with atrial fibrillation, for example. So why would your patient who's coming into the hospital, they go into AFib, they've now got AFib, and they're going to be in AFib forever, and that puts them at high risk for a blood clot and a stroke. So they need to be anticoagulated. And the physician has prescribed warfarin for their long-term anticoagulation. So that is one of the first key differences. Heparin is for short-term anticoagulation. It has a short onset of action and a short duration of action. And then warfarin is more used for long-term. So heparin is given as an injection or an IV medication. And then warfarin is a PO medication or a pill. So the reason a patient would be on both of these at the same time is because warfarin takes a while to reach therapeutic levels in the body. So if the patient is just starting out on warfarin and they've been getting their heparin in the hospital to prevent clots, they're going to be on both. And that's again because the warfarin's going to take a few days to reach therapeutic levels. If we stopped the heparin right away, they would not be protected against blood clots. So we keep the heparin going until the warfarin is at therapeutic levels, and then we just transition fully over to the warfarin. And you may hear this called bridge therapy. There's all kinds of bridge therapies in nursing. This would be a bridge therapy as it relates to anticoagulation. And yes, anytime your patient is on more than one medication that can cause anticoagulation, I want you to ask questions. I want you to be very aware of that because in some cases, it is a mistake. It has been overlooked and patients can have serious detrimental consequences. So anytime you see anticoagulants on your patient and you see more than one, definitely ask about that. But if it's heparin and newly prescribed warfarin, the reason is generally because it's going to take the warfarin a few days to reach therapeutic levels. And then for the heparin, you're monitoring the PTT or the APTT lab. And then for the warfarin, you're looking at the PT or the INR. And you can look at that to determine if the warfarin has reached therapeutic levels. So an INR of 2 to 3 is considered therapeutic for many patients who are taking warfarin. So once it gets up to that level, the heparin is going to be discontinued, and now the patient is anticoagulated on their long-term PO medication. So I hope that helps clear that up, and I hope you're enjoying these Ask Me Anything episodes. I know I certainly am. You can send your questions to me at team@straightanursingstudent.com, and I'll be happy to answer them on another episode. And if you're a new student heading into nursing school and you're hearing horror stories about how terrifying, impossible, stressful, unmanageable, whatever that nursing school is, but you still want to succeed and thrive, I'd love for you to check out my free little class on how to thrive in nursing school without it taking over your life. And you can get access to that for free at straightanursingstudent.com/thrive. And I'll put a link to that in the episode notes as well. And I'll see you back here next week. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
At a time when change is constant and we are pulled in far too many directions, we need a way to stay present to life and to increase our ability to remain calm, think clearly, and maintain our well-being. Many studies indicate mindfulness improves our mental, emotional, and physical health. On A Mindful Moment with Teresa McKee, you can learn how to practice mindfulness and enjoy its many benefits. Tune in for guided meditations and to hear tips and advice from some of the most respected experts in the fields of mental health and mindfulness. The world truly can be a better place. It all starts with a mindful moment.